Let me start by saying that wounds always have been a challenge. We start by talking about the wounds, their initiation, and how they first act as acute wounds, and then in the very hard to heal wounds, we find them to turn to be a chronic wounds. Today, we are going to talk about a solution, not just a dressing. It's a solution that will help you through your journey and help your patient to get the best treatment that is ever present, to make sure that whatever the challenge that your patient is facing, now you have a dressing that can address it in the right manner. So when we are talking about the barriers that we can face during the wound healing process, and actually when we were having our workshop, we were talking about that there are local factors and systemic factors. If we are pointing out to the systemic factors, because without the systemic factor, we can never have the perfect healing journey. So the introduction, if you are having poor diet, if you are having obesity, if you're having diabetes, those are certain issues that you have to handle before just looking to your wound. While the main focus that I'm going to talk about today is the local factors, which are the edema infection, especially the biofilm. And I'm sure that most of you, if not all, are aware of the biofilm concept and know how it directly influences the wound healing process. The ischemia, the low oxygen level, and of course, the necrosis and slough that we may find in these wounds. But if we say that we are having three main issues that we want to address, and you can find we are having some villains, most of you are familiar with them now. They are villains, but they are so cute because if you treat them in the right manner, they will not be villains anymore. We'll find that the excess exudate, the infection, and the biofilm are the three main villains that we are looking at. Why we are saying that they are excess exudate, not just exudate, because exudate in the adequate manner can be very helpful in the wound healing, but the infection is going through changes from the local to systemic. And the biofilm, we are going to focus more on this problem and give it its due care in this session. We're going to start by the biofilm. Simply, the biofilm are colonies that are engulfing itself by slimy layer to protect itself from any other antimicrobial that is present. At this part, the problem is not in the microorganism only. You don't need something to kill the microorganism only, but you need something also to penetrate through the biofilm. There is a very common saying about the biofilm that if you did not brush your teeth for a while, you'll find a slimy appearance on your teeth, right? If it has been like from the morning and we did not brush our teeth, we can do like this. Check our teeth by our tongue. It's a bit slimy. Is it? It's a bit slimy. You know why? Because in this stained photo here, here you can find that this is a stained biofilm that shows that the biofilm is easily formed. And this happens if you leave the place which is able to anchor the microorganism for over 2 or 3 hours. So simply how it happens, how does the biofilm form? It started by finding a surface to attach to. In our case here, it will be the womb bed, and then making the colonies and increasing in the size, and then increasing this size and engulfing itself by this slime layer. The true issue with the biofilm that the new formed colonies here, if you see here in this photo, the new formed colonies are biofilm colonies. So by the regular means of mechanical debridement or sharp debridement, it will not be enough, because if you lift even a small remnant part of this biofilm, it will be able to make new biofilm colonies as well. This is a beautiful photo with the biofilm under the electron microscope, which is the gold standard of identification of the biofilm. It started by the planktonic form of bacteria, and then it aggregates together. Part by part, it loses its morphological appearance. And this happens because the slime that engulfs itself with it is completely covering it. The problem with the biofilm, again, that it prevents any outsider antimicrobials from acting. It turns to be sort of like a rug at the end of the process. But we don't have the luxury of making electronic microscopy to every wound. And this is why we turn to try to visualize how to identify the biofilm. Identifying the biofilm visually is more likely by the glossy appearance, this one, that you can find on your wound while you are having low-grade inflammatory reaction in the sites. So why biofilm is a problem? Because it's contributing to almost 30% of the chronic wound retardation, and it also keeps the low-grade inflammation present. So it turns your wound from a wound that has high tendency to heal into something with a foreign body that does not allow it to heal. If we look at these photos, we find some diseased granulation tissue formed. We'll find some other types of colonies here. And all of these photos shows to you that there is a chronic problem that is preventing wound from closure. And this is simply because it's suspected biofilm. And I guess if you do electronic microscopy to any of this, you will find the photos that we just saw in the electronic microscope. Again, this is a drawing that shows to you that the biofilm is physically present. It's not just a mess, it's physically present, hindering the wound healing process. When we're having the biofilm, it has its toxins getting in. And if you use just antimicrobials, if you use just antibiotic at this point, it may be able to work through this tissue, but it will not be able to handle the biofilm itself. So simply, when we're talking about the tooth part, if you brush your teeth, do you still have this slimy feeling? No, you will lose it. So the first and most important part when dealing with the biofilm, that it should be mechanically removed. This is the most important part. But you will find at this point that there is another problem, which is that even if you are mechanically removing it, a small remnant part is enough to form new biofilm colonies and start the process. So at this point, you will need to mechanically remove it and then use something that will be actively dissolving the remnants of the biofilm and preventing its reformation again. Another barrier that we have is the infection. And in this great photo, we'll see how the beefy red color of the wound happens when we are having clean wound. And we had discussion also in the workshop that there is no one that has no microorganisms at all. They all have microorganisms as contamination, but are they in enough load of making it a pathogen form of microorganism or not? In this case, the body defensive mechanism is in control. And the size and the shape of the microorganism here will be planktonic, which is not aggregated, no colonies is still formed. Once they found the surface, and this surface is enough to anchor the microorganism and start the multiplication process and colonization, and then it will be, luckily for, unlikely for the patient, and for his misfortune or her misfortune, it will be a biofilm forming microorganism. They will engulf itself by the slime layer. Now, at this point, visually, we will see, as I mentioned to you, the low-grade inflammation and the glossy appearance. This is called the critical colonization phase. Your body here is still trying to defend, so it's not systemic yet, and you can locally deal with it in the perfect manner. And the last stage here, now this is systemic one. It's not just confined to the local one. You will find that the patient is having high temperature. You'll find also that the patient in this phase also tried maybe sepsis and vomiting. And if you look at the microscopic part, you will find that the microorganism has formed already biofilm colony, and it's able to make new biofilm colonies. And this is the important of not just removing it mechanically, but also using something that will not allow the biofilm to be reforming again. The causes infection is very high, including that the patient is admitted more than the period that it should be, is coming further and leaving more than once, and is occupying your time and your staff. The last villain that I'm talking about is the exudate. And as we mentioned, the exudate can be beneficial at the right manner, as it helps the fibroblast to travel in the right manner, and it helps the fibromesh to be formed. Not only that, it can be a source of nutrition to the wound itself and help it to heal. Now, if you look at this part, we'll find that this one is macerated skin, which is the peri-wound skin. And as all of you noticed, the wound is healing from the preface to the center, so we need healthy peri-wound skin in order for this wound to heal in the right manner. Introducing you the solution from Convatec. Simply the solution here that three villains are present: the exudate, the infection, and the biofilm, which is our main focus in this session. We're having two powerful technologies working together. One of them is Ag+, and when we're saying Ag+, we are not saying ionic silver only. No, we are saying ionic silver as an antimicrobial with plus. Plus is the antibiofilm material that penetrates through the biofilm and allow it to kill the microorganism, and the hydrofiber, which is the active ingredient of the Aquacel. And there is no other company, not in the whole world, that's offering you this combination. They don't have hydrofiber, they don't have antibiofilm. Even if they have the plus sign, it's for ionic, not for the antibiofilm. So both of them is one family, which is the Aquacel Ag+ Extra. As we mentioned, the plus technology is able to disrupt and break the biofilm and then kill the microorganism. And the last part, it prevents its reformation. You know why? Because it has passive way of engulfing the remaining microorganisms and preventing it from forming new biofilm colonies again. So if you are saying about the hydrofiber technology itself in the aquacell, we will find it that it allows the fluids and the exudate and the other harmful components to be getting inside the fibers itself. And this is why it does not cause any lateral wicking. Your patient will never face maceration. You will have healthy peri-wound skin to heal your wound from the preface to the center. And then it makes micro-contouring. The micro-contouring simply that no wound is as smooth as this surface. It always has its ups and downs. Micro-contouring means that when this fiber swells, it takes the exact morphological shape of the wound, preventing any dead spaces which harbor the microorganisms to live in. And then it responds. It responds by having sustained release of the antimicrobial, which is the ionic silver, and sustained release of the plus technology, which is the anti-biofilm technology, along with the soothing effect it provides to your wound. How it looks like? It looks like two sheets, stronger stitched together, and this is called the AquaCell AG Plus Extra. It has different sizes, 5 by 5, 10 by 10, and 15 by 15. And for the deep wounds or tunneling wounds, you can use the rope, which is 2 centimeter by 45 centimeter. Again, is it proven? Yes, it's proven. This study was done just to prove to you that the biofilm is a true problem, because we did not make it with anything except our own selves. We made it with ourselves to show that the old form, which was named AquaCell AG only, without the plus technology, was unable to kill the MRSA in its biofilm colony form, while the new form, which is the AG Plus technology, was able to completely eradicate the MRSA colonies in its biofilm form. So thank you for that. And I want to close with this study. It was a non-comparative 42 chronic venous ulcers, since we are here talking to most of you, like seeing mostly the venous leg ulcers. It completely reduced 54% all of the ones infected and non-infected, while the infected one, which were more suspectedly having biofilm, it reduced it by 70%. Talk about effectiveness, talk about AquaCell AG Plus Extra. Thank you for that. And I want to tell you in the last part that any exuding wound that you are having glossy appearance to it, your first choice as a primary dressing can be AquaCell AG Plus Extra, with full confidence that it will not only eradicate the microorganism presence, but it will also eradicate the presence of the biofilm. It's available also in the rope form. When you are doing it to a deep wound, only pack 80%, because once it absorbs the fluid that is present, specifically the exudate, it turns to swell. So only pack 80% and leave 2 centimeters outside to pull it. Thank you for your time, and I'm here to answer any questions.
Thank you.